Peace be to you. This is Omar Abdul Malik, physician assistant and health educator here on my... Hey lady, I said I was gonna do one more super long run before the marathon in 4 weeks, but I'm off this weekend, so I thought let me get another 23 miler in there. Anyways, so today I'm going to talk about how to survive your pediatric rotations. So I'm going to do a series on how to get through your, whether you call it rotations or clerkships. So for PA school, it may go from 4 to 6 weeks, depending on the school. If you're in medical school, it might go a few weeks longer. And, so anyway, you're still, the same things are expected of you, whether you're in PA school or medical school, are your rotations. And that's to make the most of your rotations, learn as much as you can in those several week periods, and pass your end of rotation exam. So for your pediatric rotation, first understand what pediatric entails. So you've probably already had, by the time you'll have had your pediatric medical course. So with your rotation, you're going to actually be doing the fun stuff. So utilizing what you learned during your didactic. With peds, understand that the age range may go from premature infants all the way to folks in their early 20s. I had a pediatric patient, I was like 23. I said, yeah, I'm here for the doctor's appointment. I was like, what are you doing here? This is a pediatric clinic. He was there. He was getting his last set of peds checkups. So the age range is varies markedly. Don't kill me. Hey, how are you? Thank you. So you have to know a lot of stuff. So for your infants, and well, let me start with premature infants. You should know your pathophysiology behind it. Why was this infant premature? We had a baby that was like, I don't know, maybe 3 or 4 months premature. Just they call them butter stick babies. Some folks in the NICU do. And it was in this incubator. Baby eventually died, but he was getting like all sorts of fungemia, bacteremia, and NICU nurses are incredible. They had put IV lines, and the baby had been trached. That's incredible. Sometimes there's issues with surfactant that hasn't developed. You may have malformations that are incompatible with sustainable life. But this is where your pathophysiology comes in, where you get to understand the effects of certain teratogens, or maybe also looking at the mother. So there's some overlap with OBGYN in there. What risk factors did the mother have that may have facilitated this baby being premature? Rely heavily on your nurses, I would say, your NICU nurses, experienced ones that they know their stuff very well, and they'll help you learn. Then when you've got your regular babies, regular quote unquote, your newborns, know your various, how to do a history and physical. A history, of course, being from the mother and the delivering clinician. So be familiar with your APGAR, the baby's weight, what should a healthy newborn look like. Things like certain reflexes. So the moral reflex, rooting reflex, stepping is one called a parachute reflex, which is like a startle response. Know how neonates differ. And then as you get a bit older with the toddlers, oh my God, you may get really sick because toddlers get a lot of stuff, and you have to deal with the parents, try to explain to them that differences between why an antibiotic might not necessarily work on their child who has a viral infection, because you pan cultured them and they didn't have any bacterial infection. So the runny nose and the coughing could be due to a virus. Know your childhood viruses and bacterial infections. That's very, very important. There's some very good dermatological books. This is like roseola, rubella. Oh God, I hated having to memorize that stuff and try to, but it came in handy because I would see it in the clinic. Also understand certain dynamics, family dynamics. I did my training in a inner city hospital, so there were issues of what we thought might have been abuse. Me with my know-it-all self in my senior year of PA school, the attending showed some x-rays of this baby with bilateral hip fractures. And she said, is this abuse? How many of you all say that this is a sign of abuse? I'm up there, well, what is a mother like and what are the living conditions? Oh, it's definitely abuse. She should be reported. It turned out the baby had osteogenesis imperfecta. That's a airborne genetic disorder, so you got to know those. So me, I was all loud and wrong, quickly humbled. But no, that's as the children mature, you're going to get into things like know your Denver developmental chart. Be very familiar with that. And then your vaccines. If you have serious issues with administering vaccines and advocating for vaccines, that's something you need to discuss with your program coordinator or your rotation coordinator, and certainly the attending. You don't want to go over against your strong held beliefs, but understand that there are certain things that you may be called upon to do and say to the patient. And in regards to vaccines and other things, which leads to this. Preteen and teens, know your Tanner stages for boys and girls. How does the normal child's body look as it starts to mature? There's sexual issues that you have to discuss, and the parents aren't always privy to this. I was doing an HIV test on a teenage girl. I had to ask her the talk. Are you sexually active? Are you, if you are, do you use condoms? And I asked the mother to leave the exam room. I was like, I'm her mother. How come I can't stay? She says, ma'am, you can't stay. We got HIPAA protections even that extends to children. And I do the same thing when I take my children. I've got 4 kids, 3 of them are teens. One's a tween, so he's a preteen. So our pediatrician has the talk, and I explain to my children what that entails. They're going to ask us those questions. I say, yeah, just answer honestly. And it's not for the parents to come in. What was the test? Was it positive? You're having sex, aren't you? You're sexy. That's not for the parent to do. So, and you can't divulge that to the parent. We had some very heated discussions about that when I was in PA school, for those of us that were parents. Know your types of fractures. What other pathophysiology do you need to know? Oh, things like cryptorchism, when the testicle hasn't descended. That can be a precursor, a risk factor for cancer. But just study all of that good stuff. And you may find that you like pediatrics and you'll want to go into it. In our rotation, I rotated through the NICU, neonatal intensive care unit, as well as the PDR. So it was really interesting. I had to leave this poor kid he was in a respiratory isolation or something. I felt really bad about leaving him in the room, but what are you gonna do? But that's it. I hope this was helpful for you guys. I wish you all the best of success success in your positive endeavors. Subscribe to my channel if you feel like it. If not, that's cool too. There's better channels out there. Okay, peace. Oh yeah, and I'm available to look over people's personal statements for their CASPA. Take care.